So good morning. We're here live at the Krause Center on the Samaritan Hospital campus with Kim Baker, President of Continuing Care for St. Peter's Health Partners. Kim, thank you so much for making the time to be with us.
My pleasure.
We're here to talk about the great news that St. Peter's Health Partners recently received Integrated Care certification from the Joint Commission. Kim, you led our organization's efforts to earn that certification. Can you please tell us about the certification and our journey to achieving it?
Sure, I'm happy to. So our 3-year journey to achieving Integrated Care certification was truly a labor of love among many providers and clinicians. And the certification was created in 2015, and it recognizes organizations who effectively transition care across a continuum of services. And in particular, it focuses on our ability to share information effectively, to transition our patients and residents from the hospital to outpatient settings.
Outstanding. So why did you think it was important for our organization to seek out this certification?
Sure. So becoming a truly integrated healthcare system has always been the vision of St. Peter's Health Partners. This recognition by the Joint Commission is an important step in realizing that vision.
Now that we've earned it, what does this certification mean for us as an integrated healthcare system?
So in my mind, it is a giant leap forward for healthcare. According to the Joint Commission, Integrated Care certification recognizes health systems for improving the coordination of care, but also the outcome for our patients and our families. And it recognizes our commitment that healthcare transcends outside of the walls of the hospital and into our communities.
What does this certification mean for our patients, our residents, and those we serve?
So the process required to earn Integrated Care certification benefits our patients and our residents by way of relieving the burden of navigating not only healthcare but a very complex health system. And we believe that we are relieving that burden. We take that burden on and we effectively help them transition.
And allow them to focus on healing.
And allow them to focus on healing and getting better and taking care of their loved one.
Without getting into specifics, Kim, can you tell us about a patient who benefited from our care coordination efforts?
Sure. This is my favorite topic. I have probably hundreds, but I'll talk to you about coordination that delivers quality care to a mother and a son. And I may refer to a few notes, but Eddie Heritage House is one of our nursing homes in Troy, and it really stepped up to care for a mother and a son. Recently, it started with a 79-year-old woman who fell at home, fractured a hip, and was admitted to Samaritan Hospital. But she was also the primary caregiver of her 58-year-old son, and our home care health home aide and our nurse who had been treating this woman recognized that he was not going to be able to stay at home by himself for any extended period of time while she recovered in the hospital and then in a subacute unit. So the coordination between home care and the hospital and the nursing home identified a location or a bed for the son to stay in.
Wow.
And we were able to get the payer, the insurance company, to cover that stay. And so he was able to live with her during her recovery from her hip fracture. We were able to care for him, care for her, and then she was able to go home and be transitioned to home and recover independently while we took care of him at Eddie Heritage House.
What a great story.
So we're very proud of that.
So St. Peter's Health Partners is the first organization in New York State and one of only a few in the United States to receive this certification. Do you anticipate more systems will seek out this certification, or is there something about our system that made it uniquely positioned to achieve it?
Well, I would say yes and yes. So I definitely see other health systems following suit. The value of the integrated care coordination playbook, if you will, from the Joint Commission gives us a roadmap to develop our systems. And so, in addition, payers have also taken notice. So, for example, Anthem Blue Cross and Blue Shield now recognizes the Joint Commission Integrated Care Certification to meet their quality metrics for the hospital setting, and there is a value-based payment associated with that. So I'm sure others will follow.
In terms of care coordination, what's next for St. Peter's Health Partners?
So we still have a lot of work to do. This is a marathon, multiple marathons, I would say. So we want to continue the good work that we have implemented and expand that across the partners in all of our locations. But really, most importantly, is we're very focused on behavioral health. And 1 in 5 individuals nationwide suffer from some level of behavioral health need. And so the Joint Commission in 2019 will be publishing additional elements and standards to certify health systems that can coordinate care for individuals who have those needs. And so we will be focused over the next 3 years leading up to our next certification in 2021 to identify improved systems whereby we can take care of those needs and coordinate care for positive outcomes.
Kim, thank you so much for making the time to be with us here today.
I'm happy to. Thank you so much.
Take care.
You too.